I'm pleased to be joined now by Dr. Ray Copes with Public Health Ontario. We just heard you address some of the delegates here. Now, you were just discussing the different environments and how they all seem to be changing. So where do we even begin to tackle some of these issues?
Well, I suppose it depends on your sort of particular interest or ability to act and to change a particular environment. I mean, my particular interest has always been in the physical environment as opposed to, say, social or economic environments, although those are important. So, I mean, my emphasis and focus is certainly on what's in that physical environment around us that can both sustain and nourish us and also serve as a form of threat and harm. And how do we ensure that that physical environment is as healthy as possible or as health promoting as possible.
You discussed environments from food to climate to the economy. Which area do you think has the biggest impact on us?
Well, I suppose that all depends what your state of need is. If you don't have a job, if you've got no way of earning a livelihood, obviously your economic environment is pretty pressing. But I think all of us live in a physical space, and we perhaps underappreciate how important that physical space can be as a determinant of health. So certainly some of the estimates of the influence of physical environments, say in Canada, have indicated that perhaps 13% of our sort of burden of illness may come from factors in the physical environment. And there are probably some aspects of that physical environment that we don't pay enough attention to.
Of these different environments, which one do you think has the most potential for improvement?
Well, there have been some really encouraging changes in levels of outdoor air pollutants in the last decade or so. So there's been progress there. Of course, our track record on climate change and carbon dioxide levels overall globally hasn't been anywhere near as encouraging. And most of us actually spend most of our time, as you and I are now doing, in an indoor environment. And certainly looking at what's in the indoor air and how that affects our health is another area where we could probably invest more resources and probably take some further action to improve the quality of the air that we breathe indoors, where we spend 85–90% of our time.
What would you like to see happen in the future?
What I'd like to see is people look at the environment as an integral component of how they plan for healthy communities, and I think a better balanced understanding of the environmental influences on our health.
Dr. Copes, thanks for taking the time to stop by.
You're quite welcome. Thank you.